I'm Giancarlo Bierkes.
And I'm Gokul Nair, and we're Impulse Biomedical, a medical devices company
that empowers lives by breaking barriers of access to life-saving healthcare technologies. South Africa has the 4th highest death toll rate for asthma patients between the ages of 5 and 35. Not only that, the 3rd leading cause for child hospitalizations in this country is asthma. Why? Working with the Allergy Foundation of South Africa, we found that pediatric, geriatric, and disabled asthma patients struggle to use their own asthma pump. In addition to that, most don't have dosage counters, and unfortunately 42% of school kids refuse to carry their inhalers in fear of being bullied and made fun of.
But the problem with inhalers is that they are difficult to use because they require quite a lot of force for them to be actuated. And the alternatives, which are dry powder inhalers and breath-actuated inhalers, are more expensive and are not routinely available in the public health service.
Our patented lever mechanism reduces the activation force from 4 kilograms down to less than 1 kilogram of force, meaning that a child as young as 4 and 5 can now use their own inhaler when they need to. We have a built-in dosage counter that counts down anything from 0 to 300 doses, that clicking sound you hear, and finally our animated characters that make your asthma pump fun, cool, and interesting for kids.
What we're finding already is better lung function and better asthma control as a result of the Easy Squeezy. We're also finding that patients find it a lot more accessible and more intuitive to use the asthma inhaler. With this, we want to expand not just into the pediatric population, but to include the elderly as well as we develop this device further. The SAB Foundation grant will allow us to develop molds for an Easy Squeezy that fits with an inhaler that dispenses corticosteroids. Furthermore, we aim to develop marketing material with the use of inhalers, spacers, as well as Easy Squeezies. And the end goal is to improve asthma clinical outcomes. Over the next 3 years, we envision developing a smart Easy Squeezy that connects with the patient's phone, with seamlessly keeping track of their doses and enabling clinicians to better understand how their patients are controlling their asthma.
Join us in breaking barriers and making Easy Squeezy accessible to all.